Good evening. Welcome to Couch Conversations with the Doctors, hosted by Congressman Danny K. Davis and Nikki Harvey. My name is Dr. Maya, also known as Maya 100. They're out today. So tonight I'm going to make my attempt at being your host with the most. All right. And we have some illustrious guests here tonight. And I'll just make a round and ask them to introduce themselves. I'm going to start with our guest, Dr. David Miller. Please let the community know who you are. We already do, but allow this minute, as Jay, take this time to reintroduce yourself.
Well, good evening, everybody. It's great to be here. Great to be back. I'm David Miller. I'm a practicing dentist for almost over 30 years and former state legislator in the Illinois House at one point for a decade, but also I was the state dental director for here in Illinois. So I've seen a whole host of aspects of oral health. It's not just dentistry, but oral health and how it's interrelated to your overall health. It's good to be here.
So much, Dr. Miller. I'm going to hand it to Dr. Tony Hampton, doing a lot of work in the community, helping us with our nutrition, our lifestyle in the South suburbs, and I think South Side, doing the work that our community needs. Dr. Hampton, please introduce yourself.
Thank you, Dr. Maya. Always happy to be with you guys. I enjoy being in the clinic. I enjoy being on YouTube and at conferences because we have to really spread the message that food is medicine. I'm a obesity and family doctor on the south side of Chicago, actually, to answer that question. I work on 98th and Western with Advocate Health. I've been with them about 18 years. Prior to that, I worked for Circle Family Care on the west side, the best side if you're from that part of town, and used to work for them prior to graduating from West Suburban in Oak Park, where I trained as a family doc. So always trying to touch the community this way because I think it's a good way to directly answer questions and or share information. So I'm really happy to be here and looking forward to our conversation today.
So, Dr. Hampton, all this time I'm consistently hitting you up about South Suburban. You just can't answer. Well, thank you so much for always being available for community. Now, speaking of community, have you ever met a healthcare executive that's also a community advocate that has years and years of experience? Mr. Harrington, please introduce yourself.
Thank you, Dr. 100. I spent most of my career in public health and healthcare, but I've also done work in mental health and education. Early in my career, I was actually working for the City of Chicago Department of Public Health as a community mental health worker in my early 20s. Fast forward, I did a lot of work. I managed a federal program in parochial schools. It's kindergarten to third grade. I went back to the health department in 1980, was there for 10 years, then left, worked at 3 hospitals. University of Illinois was the first, and then I went to Mount Sinai, and then I went to Rush, left Rush, and went back to the city as an assistant commissioner. And then when Dr. Mason became commissioner, I went to the city of Chicago as an assistant commissioner and left in 2012, went to the state health department where I had the chance to work with Dr. Miller, and I was the regional health officer for for Cook County. So we have some work history together too. We're friends and we have work history too.
So, Mr. Harrington, so many layers upon layers of what we call in my neighborhood receipts of what you've done in the community. So let's get started with our topic. Ashe. Let's get started with our topic for today. Before we do that, thanks to Congressman Danny Davis and Nikki Harvey for making this space where we can connect with community and also community can connect with us. And we stand not outside of, but inside community, and we stand up for community. Well, February is Heart Disease Awareness Month. And as you all know, heart disease remains the leading cause of death for both men and women in the United States, impacting millions of individuals and their families every year. Heart disease, I'll just kick it off and then I'll kick it to my comrade. So heart disease encompasses a range of cardiovascular conditions. It can be disease of the heart itself. It can be disease of the arteries that supply the heart. It can be a misalignment of the beating of the heart, known as arrhythmias, and it can be much more. So understanding the mechanisms, risk factors, and preventive measures of heart disease, which I know Dr. Hampton is going to get into, is crucial for reducing this impact on the United States. Okay, we can start out with who it affects, things like that. I don't know if any of my colleagues want to delve into that.
Yeah,
go ahead. You go ahead.
Yeah, you know, when I went to the health department in 1980, I was responsible for a citywide program focused on blood pressure control. Worked very closely with the Heart Association. But one of the things I think is important for people to understand is the circulatory system. That's the system that transports blood through the arteries and veins, and is what brings oxygen and nutrition to all the parts of the body. And if there's an obstruction of blood flow anywhere in the body, there's going to be a problem. You're going to have a problem. In the brain, it's probably going to be a stroke, and the heart is going to be a heart attack. But I just wanted to point out that it's the circulatory system is sort of we're talking about. And anywhere the blood flows, you can identify a problem. And I think that's what we're going to talk about later. But I'm going to stop and let Dr. Miller talk about it from the standpoint of oral health, because I think that's what we wanted to do, to let people know that you can detect this problem in a variety of body areas just based upon observation.
Yeah, one of the things, thanks, Dr. Harrington. One of the things I wanted to bring out is the prevalence between periodontal disease, which is gum disease, and I'll talk about that in a second, and cardiovascular disease, particularly the high rate with African American women. And I think just to go a little deeper here, the mouth is basically the gateway of the body and one of the most dirtiest parts of your whole anatomy, because bacteria comes in, you talk to people, you eat. So it is a presence of bacteria that can come in. And all of us have bacteria in our mouth because it keeps our oral health sort of constant. But however, if that gets changed, if it gets because of any antibiotics or disease, then you can get other diseases that can start to creep in. One of the things about keeping our mouth clean is because when we brush, we reduce the bacteria in our mouths. And that's one of the key points about cardiovascular disease, as Dr. Harrington said, in terms of trying to keep your circulatory system clean. Because once that is infected, then it can also affect your gum health in addition. So it's a cyclic issue. For some reason, African American women have a higher prevalence for it, and we can certainly delve in that a little bit later.
Okay. All right. So we all know that heart disease is responsible for about 1 out of every 4 deaths in the United States, making it one of the most lethal conditions nationwide. Approximately 700,000 Americans died from heart disease in about 2020, and it accounts for about 23% of all deaths in the country. Okay. All right. So let's talk about why women. All right. Dr. Hampton, you can get into the metabolic state of someone, but most of that adiposity or that fatty tissue kind of being around the hip area, whether you're pear-shaped or apple-shaped, things like that, play into the equation. Certainly we're seeing, well, I'm seeing as a practitioner, people after menopause having increased risk, things like that. It definitely affects women, affects men too. When we look at culturally, ethnicity, who is impacting? It's impacting African Americans. African Americans are bearing the brunt of heart disease and poor outcomes, whether it's delayed or late diagnosis or treatment and prevention, getting from that primary prevention, which is kind of everything that a lot of stuff that Dr. Hampton talks about, doing everything you can to make sure you don't end up with heart disease, looking at your family history, taking in certain nutrition, keeping your body active, things like that. Or secondary, getting your screenings, getting access to care so that you can get screened. And then once we know you have heart disease, preventing tertiary preventive health, which is everything we do to keep you out of the hospital for cardiac failure, right? African Americans are bearing the brunt or experiencing delayed diagnosis and inequities in heart disease. So let's talk about preventive. We talk about preventive. Dr. Mason always says, food is medicine. Do everything you can to stay out of it. By the time you have those symptoms of chest pain or shortness of breath or swelling of your legs, things like that, we're already down that road. So, Dr. Hampton, let me ask you, start with nutrition. What are the things that you look at for primary prevention?
Yeah,
what do we do to keep from getting heart failure?
Yeah, it's actually when I came up with my protecting your nest like theme for my podcast and YouTube channel, it was really more about the root cause of disease than anything. So if you look at that nest acronym, we start with the food, and it's not just what you eat, it's when you eat it. So you can actually fast. I know a lot of people did the Daniel fast recently from their church, and in that setting, you're resting your body, and you're also eating whole foods. You're not eating processed foods. So that type of model where you don't eat the wrong foods that are inflammatory to your body, that'll actually, because inflammation is what actually promotes the collection of plaques in your arteries, right?
Yeah.
So, and I always use the example of, you need cholesterol to tuck point your home. You need mortar, should I say, to tuck point your home, but cholesterol is like the mortar to tuck point your arteries to help repair inflammation. So the less inflammation, the less your cholesterol will become a problem. So the first ideal is, if I take a break from eating, I fast and I do better, less inflammation, but I also want to eat low inflammation foods. So if I eat foods that don't inflame me, like eating, instead of eating like a processed, like meal replacement bar, which sounds healthy, but it's processed, instead eat whole foods. Shop on a part of the grocery store where the meat, the non-starchy vegetables are, and those types of things will help you to heal. Then you have the E in the nest. You got to move your body. I work with my trainer tomorrow morning. When I exercise with my trainer, don't like going to the trainer, but when I'm done with the trainer, I feel great. So we need to move our body, but don't overdo it, because then you're prone to injuries and things like that. The S is for sleep and stress. Again, too much stress, not enough sleep, you're going to get inflammation. And so I think a lot of it is understanding the basic principles that will then result in you not in stress, then raises your blood sugar. And cardiovascular disease is a disease of blood vessels. That's why it includes things like stroke and poor circulation leading to amputation, peripheral artery disease. So it's really interesting how, if we deal with the inflammation by eating properly, etc., all of a sudden we don't have the sugar spikes, and the sugar spikes leads to something called insulin resistance, and where the insulin's not working well, so the sugar is even higher because the insulin raises. And by the way, too much insulin also makes you larger, which then exacerbates things even more. So I think what I try to teach people in my clinic is, instead of just focusing on the Band-Aids, we're going to get you on a statin, we're going to get you on a blood pressure medicine. We're going to do those things too as we bridge you towards healing. But if you don't address the root cause, which is I'm not moving, I'm eating poorly, I'm under too much stress, I'm not getting enough sleep. If you don't prioritize those things, then you're gonna be a person with 10 medicines, and you're not going to get to the root cause, and you're ultimately going to succumb to cardiovascular disease because you didn't address the root cause. So is it possible to get off blood pressure medicines? Yes. Is it possible to get off? I had a video of an 89-year-old. His name is Mr. Oatman, 89-year-old, who simply changed his diet, and within 4 months, his A1C went from a 9.0 to a 4.6 in 4 months. He was on Trulicity and on glipizide. He's not taking any medicine. So, but if he had only stayed on the medicine and controlled his blood sugars, he would have stayed on the medicine for the rest of his life. He simply changed his diet. So that's why it's so important that we get people to understand that.
Thank you, Dr. Hampton. I want to say hello to Laura Leone, Mount Sinai Hospital. The Core Center. Hello. Audrey J. Cox, Linda Johnson, Alderman Pat Dowell. Thank you for your service. President Kerry Steele, thank you for your service. Dorothy Murphy, Bonnie Smedley. And I want to encourage the community to send in your questions if you have any. I want to say hello to Dr. Travis, Karen Scott, President David Sanders from Malcolm X College, Dr. Roy Walker. Thank you so much. Alexi Julianis, our Secretary of State. Thank you. Patricia Weber, Pamela Dominguez. Hello, everyone. And thank you so much for joining. Now, speaking of all these people that focus on the community access. Okay, go ahead.
Yeah, go ahead, Joe.
Yeah, I just, a couple of things. One, Dr. Tony, what was the patient's blood pressure? You talked about their diabetes a little bit. So their blood pressure went down as well. I mean, I think
they
that's
lost weight and their blood pressure is in a normal range. I think it was just slightly elevated, but that because it's all the same disease. Right. I think that's why your question is profound. It's if you have blood vessels everywhere. So if you have a blood vessel problem, you're going to have problems everywhere. So that's why when you make these interventions, you fix a lot of things that keep you up at night, a lot of things that led to your family. And what he said real quick is that he lost 4 family members, mom, 2 siblings, and I think an uncle. And they all died from diabetes, but did not have to. And so he'll be 90 this month. And he said, I'm going to just do what you say, doc. And he did it. And if I can it's hard as a doctor to figure out how to convince people to make, at least try these things. But when they do, it's a miracle. You see miracles happen.
Yeah. And I also wanted to make the point that there are modifiable risk factors, are things that you can do, and they're things that you have no control over. Yep. Your risk increase as you get older, and you have no control over that. So be thankful for whatever age you are. Your family history has a bearing, and so you can't change your family history.
That's right.
And sometimes sex can be a risk factor because men are more likely to have a risk of heart disease than women. But if you're smoking, you need to stop. If you're not being physically active, if you're not moving, that's a risk factor. As Dr. Tony said, an unhealthy diet is a risk factor. Excessive alcohol consumption, and I think I already said it, but smoking, in spite of what people may think, is still a major contributing factor to a lot of deaths in Chicago. Yeah. So if you're smoking, stop immediately.
Yeah, one thing I wanted to add in was Dr. Tony had mentioned, and Dr. Harrington had mentioned about inflammation. And I think that's the key. When you look at the word gingivitis, ginger means gum, itis means inflammation. That means the gum is your gums are just swollen. And when the food sits on your gums and you don't brush it away, they become swollen. They become, and that's where you may see bleeding gums. And if that food sits there long enough, it hardens on the teeth, called calculus, we call it, or tartar. You hear it on a commercial. But even they say tartar prevention doesn't mean you're getting rid of tartar. But the analogy would be of tartar is like if you had a splinter under your hand and left the splinter there. Your hand would be red and funky and start to bleed a little bit. And if you left it long enough, it would get gangrenous and move on. That's an infection. And so what Dr. Tony had mentioned about reducing infections, not just throughout your body, and as Joe had said, this is something you can do at home, which is brush your teeth 3 times a day, go see a dentist, remove the tartar, which is very difficult. We can't do it at home. We usually go to a professional to do it. But that all reduces the inflammation that can cause the swelling, that reduces the bacteria, and that can help with your cardiovascular disease.
Thank you so much, Dr. Miller, for that. All right, so we've talked about preventive health. All right, primary prevention. Let's talk about secondary prevention, which usually includes screening, right? And immediate treatment so that someone is experiencing heart disease or but not necessarily ending up with what we call sequelae or poor outcomes like heart attack, kidney failure, those type of things. So we're at secondary prevention now, which includes screening. Does anybody want to jump in with the coming screening test?
I'd like to jump in for a second here. I mean, many dental offices check blood pressure, and particularly those, patient comes in with needing an extraction, a tooth removed because of pain or this, that, and the other. And a lot of times, patients don't know they have high blood pressure. All of a sudden, now you could say because they're nervous in a dental practice, that's normal, or they're in pain, they've been able to sleep, that's normal too, to have, a higher blood pressure than normal. But I've seen patients come in with, 200 over 100 diastolic, unheard of, and they didn't know. And they're functioning perfectly fine. You may ask them, how does it feel when you go up the steps? Well, I'm a little winded. And they could be thin. They could be, it's not your typical, what you would think is maybe someone obese or old or whatever. It could be any of us with it. And so one of the front lines of detection is when they come in a dental office. And when we take blood pressures and say, Mr. Jones, hey, there's a physician. Did you take your blood pressure medication today? I didn't know I had to. Did you? Well, let's have a conversation about that now. The importance of it, because because there are certain recommendations for patients that you can't treat, because of their elevated, and there's just too much risk factor. And the last point I want to just bring up is patients sometimes don't tell you, this has happened to me, their own blood thinners. By the way, Dr. Miller, I started taking blood thinners, and there's different protocol. And we can talk about that later, but there's different protocols when those patients come in too. So there are a lot of things where we can be a front line and just really consult the patient and be an advocate on their behalf.
Thank you, Dr. Miller. I just want to add to the screening. So in primary care, some of the things you may have seen when you go into the office that we don't think about are also the blood pressures. And I can't tell you how many people that we found to have high blood pressure, sometimes diabetes, from catching things on screening at the dental office. At the dental office, and they refer them to us, and we're like, oh, okay, that's there, because maybe a person's out of care and want to get that dental stuff together, right? Monitoring blood pressure, cholesterol levels, screening for diabetes. Dr. Hampton mentioned all these things are intertwined. And then there's a good old EKG where they check the electricity going through your heart. They put the stickies on you. They have you lay still, and they just take a snapshot of how the electricity or the conduction is going, how well your heart is beating. There are other tests that go into that where they may lead you to get an ultrasound and things like that. But those are the basic in-office screenings. Dr. Hampton or Harrington, did I miss anything for basic in-office screenings for heart disease?
No. What I wanted to add, and this is context for people. The average heartbeat is about 60 times a minute. That's about average. And if it goes higher than that, it's deemed above normal. The average blood pressure is anything less than 120 over 80. So you hear the numbers, but if you don't know what the numbers mean, you won't know when your blood pressure is high. So anything less than 120 over 80 is considered normal. Anything over that is considered high. And they generally diagnose high blood pressure when the top number, which is systolic, that's pumping pressure, is over 140, or your diastolic consistently, both of these are consistent numbers, is over 90. So that's when they generally, so you should be trending somewhere between 120 over 80 to maybe 140 over 90. Once you pass that mark, if your blood pressure is consistently high, because it goes up and down, it fluctuates all the time. But if it's consistently greater than 140 over 90, then you potentially have a problem that could lead to a stroke or a heart attack. The other thing, because I looked at it real quick, because I think you need to understand the average heart beats 100,000 times in a day. So you really are dependent upon that. I mean, if it stops, I mean, it's going to be a big problem. And a heart attack or stroke is a symptom, or is not a symptom, it's an outcome of you not being healthy for an extended period. That's what people don't know. People are waiting for something to make them feel a certain way. And I've seen, and I'm sure my colleagues have seen patients with elevated blood pressures that you would be a person that knows what's going. We would be surprised that you're still walking around and talking to
Yeah.
someone with a blood pressure that high. It's shocking.
Yep. And hello to Cleveland Atkins and Miss Deborah from Coleman's Barbecue. I also want to add to that some things that, okay, so Dr. Mason always tells us if you're having the chest pains, if you're having the shortness of breath, the swelling of the legs, those type of things, you don't want to wait till those things happen because now we're past screening. We're past, primary prevention, screening. Yes, you'll go to the doctor and get screened and diagnosed at that time. But now we're leading into the need for tertiary prevention. And we learned during COVID, we're trying to keep our community out of that, right? We don't even want our community at the tertiary prevention stage, right? We want them at primary prevention. We find out we prevent the disease from being in our community. If you get screened, we want treatment at secondary prevention. Treatment for that usually involves lifestyle changes that Dr. Hampton specializes in. And Dr. Hampton and Dr. Mason are always telling us all the doctors should specialize in that. That way, we have a healthier community, right? The lifestyle changes, sometimes medications, depending on whether it's high cholesterol, diabetes, high blood pressure, contributing to this heart disease, the medications help, and lifestyle changes at first, medications help, and then occasionally there's surgical interventions when we get to the tertiary stage. Now, I'm down the line, I'm in the hospital, I've had some kind of cardiac event, stroke, MI, things like that, or I have further stages of heart failure where my heart just really isn't being in that efficient pump that it needs to be. Now I'm doing that. I'm at tertiary prevention. And now I'm having bouts in the hospital, also trying to work with my community doctor to make sure I have less of those bouts, but definitely including all those things, the lifestyle changes we talk about for prevention, primary health, those are still important. The secondary stuff we talked about where you adhering to either the medication or whatever plan you got with the provider you trust at the secondary prevention stage, right? Because I'm trying to stop the times where I need that tertiary hospital care and, end stage manifestations of heart disease, right? Okay, so tertiary prevention. Anybody want to say anything about tertiary prevention once you're in the hospital, once you're having the end sequelae or end stage things of heart failure?
Yeah.
Anybody got comments on that?
Well, let me say this first. The first thing I think about, first of all, when we think about the advocate approach, a lot of people were concerned when we were thinking about building a new hospital, Trinity, replacing Trinity. They were like, well, let's make a bigger hospital, and we're trying to make a smaller hospital so we can prevent people from ending up at this stage. So our goal is to create a lot of clinics in the community that are managing and helping people heal from chronic disease, so that'll help them do well in that regard. So one of the things so when you go to the hospital and you're being told we need to help you do well, medication, a lot of people come to me because they're thinking I'm the holistic doctor. I'm not anti-medicine. So if you come to the hospital, there's clinical evidence to suggest that certain medicines are very helpful, particularly while you're still in the storm. If you are in a storm, you need an umbrella, right? And I think these medications provide that. So typically for the high-risk individuals, which pretty much includes anybody that's there with a heart attack, for example, we start to think about statins. And although a lot of people in the low-carb community where I live are anti-statins, high-risk people need to think about it because it does reduce the risk that the plaques will rupture, and it does reduce inflammation. So there are side effects of statins, but if you understand your high-risk nature, that's a scenario where it may be helpful. Aspirin, everybody's, literally you're walking through the door and they're putting aspirin in your mouth before they even do anything else. And that's because aspirins are really good at preventing clots, and those platelets that kind of clump together are partly responsible for you getting clots. So they want to prevent that. You're probably familiar with SGLT2 inhibitors. Those are medicines like Jardiance that make you urinate out glucose or sugar, which is really interesting. And they do have their own risk, but the benefit is that they do help people not, it reduces your risk for heart failure. So a lot of times when you come to the hospital, they'll want you to be on that. One of the medicines has been around for years are beta blockers. Anything that ends in OL, like carvedilol, metoprolol, those medicines reduce the strain. So after you have a heart attack, their heart would have been damaged. You want to have it to relax. Beta blockers relax you. They relax your blood pressure. They slow your heart rate, and that's helpful. And then the last group I think about is ACE inhibitors, things that end in pril. Sometimes angiotensin receptor blockers like losartan. Those medicines also help lower blood pressure and protect the kidneys. So the problem here, this is why lifestyle is so important and why we emphasize it. Literally, you have statins, you have aspirin, you got Jardiance, which is the new kid on the block, which is a SGLT2 inhibitor. You got beta blockers and an ACE inhibitor. That's 5 medicines that you may walk out of the hospital on because the clinical evidence suggests that those medicines will reduce the risk that you'll have another heart attack. So my goal and my charge in life is to not make that your norm. That's not your future. That's not the life I want you to live. And if we do prevention better, not only is that an expensive way to live. I mean, Jardiance by itself retails for over $500. That's just one medicine. We're talking about 5 of them. My goal is to teach people how to not only prevent these things, but if they get it, is there a path where you can actually reduce the medicines? And my clinical experience has shown that the anti-inflammatory effects of lifestyle are greater than the anti-inflammatory effects of meds. However, I tell people you need to bridge yourself. Think about John Singleton, who is the great, producer of Boys in the Hood, who passed away. He did Dr. Sebi's approach without healing. He literally just said, I'm going to do Dr. Sebi's plant-based approach, didn't heal, and he had a stroke. So you have to give your body time to recover, and these medicines provide a path, a kind of a bridge. And then there are people who then do so well. Their blood pressure drops so much that they can't take metoprolol. They can't take lisinopril because it's like they get lightheaded. So that's the goal, is to heal enough so that you can maybe potentially get off medicines down the road.
I want to add in one of the most satisfying things that I had a patient today who used to be on blood thinners. He's no longer on it. And one of the questions, he comes in very regularly for his cleaning and his checkups with me, which is really satisfying. And so you do see patients, and I think Dr. Tony's point is 200% on the money, saying this is not the lifestyle we want you to be addicted on medications your entire life, and particularly a cocktail of medicines to keep you. And so we want you around, but in the same breath, we want you healthy without this, and not only just from the cost of it, but also from the quality of life issues that we talked about. And one thing I just want to add into is that one of the things that African Americans particularly have to deal with is actually the social determinants of health. And that really kind of goes into Dr. Joe's life mission that he's been in, because there may not have been gyms, there may not have been exercise ability, there may be food deserts, there may be all these other things that particularly African American community or communities of colors have to go through that help exacerbate the fact that we have not just cardiovascular disease, but also diabetes and other ailments that plague us. And the last point I want to make is something that Dr. Tony said: it's cyclic. Unfortunately, oral health does. He mentioned diabetes. Poor oral health. You're not able to chew your food. Will increase your chances of having diabetes. And because you're having diabetes, it will have inflammation of your gums that make you less chew your food. And so, and that's one of the cycles that we dentists and oral health practitioners have to face with many patients today.
Yeah, I wanted to piggyback on that, because what I want people to understand: if you have heart disease, you have heart disease. what Dr. Tony's talking about is managing heart disease. Doesn't mean that the heart disease go away, but you can live with it and live a long, healthy life. But if you don't work with your healthcare provider to manage it properly, you're going to have a bad outcome. And what happens is people either don't take their medicine, or what's the simplest thing to do is to reduce the risk factors. And that's what he's talking about. If you're smoking, you need to stop. If you can change your diet and lose weight, and we all need to move more than we do. Those simple things will reduce your risk of heart disease and diabetes and a lot of the other complications we see. One of the things that's really disturbing, and it's related in one sense and it's not, is a lot of people are trying to figure out why there's this proliferation of dialysis centers in the Black and brown community. And basically, it gets back to two things: hypertension, uncontrolled hypertension, and uncontrolled diabetes. And there's money in dialysis. That's why the centers are there. And you don't want to wind up like that, I can assure you. So again, we're just encouraging you to try to lead a healthy life. The last thing that I'm going to say, because it's something that's always fascinated me, and it's this thing called allostasis. And we all have, it's a concept that describes how the body adapts to stress. And some people find themselves in more stressful conditions than others. And some people live in neighborhoods that are highly stressful. And there has been documented evidence that African Americans, based upon, and anybody based upon the neighborhoods they live on, tend to have higher allostatic loads. And that could contribute. It's something that you can't control, but you can control how you deal with the things in your life on a day-to-day basis.
Thank you, Mr. Harrington, for mentioning that, the stress factor, right? Dr. Hampton mentioned it earlier. Increasing your cortisol, increasing those things, contributing to heart disease, contributing to that. So let's review. We got our heart. We can have heart disease based on a couple of things. The vessels that feed the heart can be damaged, so we're not getting enough blood, oxygen, nutrients to the heart, and there's heart disease that way. There's heart disease if I have poor dental health and inflammation that impacts the vessels. But as Dr. Miller may have mentioned, it also sends those informations, plaques, down to the valves, damages the valves. So the valves have, boom, 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 they're not beating in together like a song, like a dance, right? That causes it. We can also have high blood pressure. I always do my family medicine talk where, I don't know if you all remember when you were a kid, you were blowing up balloons. For some reason, you wanted those long balloons. It was a long tube, but that little hole, and you would blow. And you keep going. And you see how your jaws hurt? It's because you got more nerves that end in your face. But if you think about that long tube as your blood vessel, and your jaws and your mouth as your heart, high blood pressure is the pressure your heart feels when it's trying to pump blood to your body. That's high blood pressure. Diabetes damages the blood vessels, the blood cells that are supposed to feed the vessels itself, right? And so the stress, high stress, not getting enough sleep does not give your body, Dr. Hampton mentioned, you have to let your body heal. Your body typically only heals when you sleep. Everybody wonder why people sleep in the hospital, and the hospital is the hardest place to sleep, but they always want you to go to sleep. It's because your body heals while it sleeps. So sleep apnea, all those things contribute to what you're saying, you're doing. So here's some things also I want to mention in the community that we're looking to do about it. Getting together, talking about it, making efforts so we increase awareness in places like this, but also we're having Wear Red Day at Loretto Hospital. And that's going to be Sunday, February 16th from 1 to 5 p.m. Sunday, February 16th, 2025, from 1 to 5 p.m. We're going to have community discussions all the way from mental and behavioral health to dental health to psychological health to family medicine, primary care health, and community health. We're all going to be there. Join us. Loretto Hospital, 645 South Central Avenue, Chicago, Illinois, 60644. Sunday, February 16th, 2025, from 1 to 5 p.m. Come out, talk with community, be amongst community. Oh, spiritual health. We got past the stuff. We talking about heart disease.
Amen.
Disease of the natural heart, spiritual heart, things like that. I think it was Mr. Harrington that was just talking about living in certain neighborhoods with Dr. Miller mentioned social determinants of health. You know, there's a book, Political Determinants of Health. There's a book called The Weathering. There's a book called The Body Keeps the Score. How all these things around us really impact our health in a lot of ways, but certainly our heart health, right? Where do we put that? We definitely have medical providers that help. We have people that help with the body in different areas, right? We have people that help with the community, but somewhere to let that out, meditate and focus, that has been, and increasing hope. The hope factor has been shown to really help. Pastor Sai, we want to hear what you have to say. We're talking about heart disease and how community can prevent and heal from heart disease.
Yeah, thank you so much. And hello to all the doctors and everyone and Brother Harrington. Boy, I'm telling you, this topic is right on point for me. It really is. And talking about heart, because on tomorrow morning, I'm actually having an angiogram, right? And
Oh,
so
wow.
when we talk about heart health, right, it's spot on. And of course, I'm praying that all goes well. And with that, and when we talk about the spiritual side in terms of the heart, where all these external determinants that are important to having a healthy heart, but also internally, right? The spirit of the heart, right? The Bible says, has a lot to say about health. In 3 John, it says, which above all things that you prosper and be in good health. Good health is it's a spiritual construct that all of us should want to have, right? Because God wants us to walk in good health. Because why? He said this body that we have is the temple of the Holy Spirit. And it says we ought not to defile the body, which means we ought to be doing all we can to have a healthy body, to do what we can and be aware and be wise on how to take care of this body. And so, and even in terms on the spiritual sense, right? I think Brother Harrington, I think you're the one. Somebody talked about stress, right? And so, the opposite of stress is to walk in peace, right? And one way we do that from a spiritual standpoint is keep our mind focused on good things, keep our mind stayed on the Lord, right? And so that helps us reduce the stress by having a balanced spiritual life as we deal with the natural life and so much of the chaos and things around us. And so, in addition to the things that you all have so eloquently stated about being in good health in terms of sleep and things of that nature, you're bringing to our awareness the importance that we got to be intentional and proactive as much as we can to walk in good health and to avoid off or not place our own selves in the path of heart disease. And so this is a very wonderful topic. And, so thank you all for sharing, doctors. Even as you were talking, you were just ministering to me and encouraging me about making more healthy choices and things of that nature. And the reason how it found out for me to get to this point was that I was ill in December, the week of Christmas. They said I had pneumonia and had upper respiratory infection. Anyway, of course, through all of those X-rays, that's when the cardiologist said, I see a little something that doesn't, that there's a little concern. So anyway, I'm here today. So even through that illness, I am grateful that otherwise I wouldn't have known. And maybe there's a problem there. I pray there isn't, but it's also getting me more and more encouraged to take care of the matters of the heart spiritually, but also to take care of this body so that I can have the most healthy heart possible as I live this life. So thank you, doctor, so much.
Yeah.
One thing I want to add, what the pastor is saying is being proactive, and all patients should be proactive with themselves and question us as providers. It's okay to ask. I think the most important thing, is that am I going to be on this medication for the rest of my life? What can I do to prevent this or to change this outcome? What can I do to, and those are questions patients need to ask, but also providers need to provide that information too. And so providers have to be culturally sensitive to our communities and not to just blanket all African Americans like we wouldn't blanket any other race, religion, or sexual orientation or anything else. as one broad stroke. And so the thing is that patients that I find are most cooperative is not when you're talking down to them or saying I'm the smartest doctor in the world, but just being more on a level of compassion and caring and saying, look, I want you to be here. I want to be helpful in this process. And I think that's a part of it where the education of some of our young practitioners coming out, protect not just the African Americans, but others that come into our community to understand that we're not just going to put you on medicine and goodbye. No, we're going to work with you to to have healthy outcomes.
Dr. Miller, if I could just add, to your point, you were so right on. And I'm glad I came to that same revelation when I was during Christmas when I was ill. I want to encourage everybody to know your numbers. I think it was Dr. Pete or you, Dr. Hampton, one of our previous sessions said, know your numbers, right? And for many years, I've gotten those lipid tests, those lipid panel blood tests and all of that. And whatever the doctor said, I just took whatever he said, right? And whatever, right? And I didn't even think until I was flat on my back Christmas week, and I went through my numbers and I began to educate myself on whatever category, what it meant and what it was, right? And so though in my older age, I want to encourage everybody to know your numbers, do the research when you get it back, right? Know what you're reading concerning your cholesterol, know what you're reading concerning, the triglycerides, all of that. And that will help you be informed to make different choices where necessary. So I just want to lift that up. And again, help us to have not just heart health, but body health overall. So I just want to emphasize that, Dr. Miller.
I'll just quickly tee this up real quick. Just give me 2 seconds, Joseph. I think thinking about the pastor and, and the prayers are going out that he has the type of, information coming back that says we can work this out with lifestyle, hopefully. But still a blessing because it was incidental, right? Incidental finding. So when you can come to the doctor without holding your chest in pain and just have an incidental finding, even if you need to do something, there's an opportunity to do something. So I'm really excited that you'll have that opportunity. But I think everybody should think about the non-traditional test, which is a fasting insulin level. And that's important because if your insulin is high, that means that your body's working overtime to keep your blood sugars normal. In many cases, your blood sugars will be normal for a while. So a fasting insulin level is the test that will predict diabetes and heart disease 5 to 10 years in advance. And it's a $50 test. So that's number one. Number two, I know in our health system, Advocate Health, you can get a coronary artery calcium score test, a CAC test. That test in our health system costs $49. It's out of pocket. Don't argue with your insurance about it. They're not going to pay for it, but it's $49 out of pocket. For a CT scan, it's a value. You don't get CT scans for $49 because they have to have a radiologist to read it and other factors. Health systems will do this test because they will find things periodically that will then make up for the loss. That test is also probably the best test you can take to predict a future heart attack. So if we're not at the point where we need to do an angiogram, right, and we're just curious and we're 35 and over, we can know without a doubt, do we have plaques in our arteries or not? And everybody who's over 35 should go to their health system and get that test, whether it's $50 or $100, fasting insulin and a heart scan. And that way you can at least start getting ahead of it. You may need a hook to hook you into a lifestyle that's going to support your health. And sometimes you need a hook to convince you that I need to do something now. A lot of times we walk around with the silent killer, hypertension, not realizing that it's already harming us. And the blood pressure. And Dr. Maya, you do so well with these examples, and imagine blowing into a balloon. That's just such a beautiful way to visually understand how much you're making your body work, right? And that's how you end up with congestive heart failure and things like that, because you're trying to push through a stiff artery that your body can't push through. Now your heart gets big, and now your ankles are swollen. Now you're on water pills, and that's going to affect your kidneys. Now you're taking the potassium because you're on a water pill, and that's how you start to build those medicines. And the good news is that you can heal from all of this stuff. You just need to kind of understand what led to it. And if it's a dysfunctional relationship, we need to fix the relationship. If you go home and if you don't want to go home to your significant other, you need to fix that because that'll kill you if you keep going home. If you don't want to go to your job because it's too stressful, you need to think about your job. And I just had a patient today who is a teacher, and she just was sick from her job. It wasn't the babies, it was mostly administration. But the point is, we had to start thinking about what are we going to do so that you won't be harmed by your job. So let's be thoughtful about the root cause of why we're sick, as opposed to just thinking about how to fix it with these medicines.
And I know you got to hop off, Dr. Harrington. So that was a beautiful until next Monday, because that is that time again.
Yes.
Think about the root causes and the environmental things that lead to the stress that can lead to heart disease. Mr. Harrington, I know you wanted to come in. Are you okay wrapping that up until next Monday?
Yeah, I can do it, and I think I can do it quick. Yes, I just want to tell Pastor Phils that all of us will keep him in our thoughts and prayers until he finds out. That was one of the things that I wanted to say, and I'll say this as well. If you have problems with your pipes in your house, something's going to back up and something bad is going to happen. The same thing is true of your circulatory system.
That's right.
If you got something going on in that circulatory system, something's going to burst or something's going to back up, and eventually you're going to have a problem.
Yeah.
But I've got two things that I want to share in terms of my for next Monday. And I actually saw this because I went online thinking of something, and I saw this quote, or actually it's something they have a T-shirt about. Don't lose heart, lose cigarettes, lose junk food, loosen up, and move. So I thought that was a good one. But the one that I've been sharing with people lately is something that people have already heard, and that's the serenity prayer. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference.
That's right. Beautiful serenity prayer. And let's go to Dr. David Miller. We do these until next Mondays. What message do you want to send to the community until next Monday?
Well, first off, the cyclic nature of what can cause cardiovascular disease and what you can do about it. I mean, we spend money on all kinds of stuff. So we can spend money on a toothbrush, and we can brush our teeth 3 times a day, and we can just have better oral health. As we mentioned, stop smoking, and all these little things will help your entire system. You can't have health if you don't have good oral health, and if you don't have good oral health, you're not going to have health. And so it's all interrelated, and just want to make sure that we are here to help you. We are with you, and if you have questions, most importantly, if patients have questions about their health care, ask. If they're uncomfortable with the provider, there's always a second opinion. And there are many providers that you can just come and talk to, and you have to be comfortable, and they should be respectful of you. And that's something I want to leave, because you're empowered to be healthy. We want to see you healthy as possible.
Empowered to be healthy. Thank you so much, Dr. Miller. Pastor Side, coming to you. Until next Monday.
Until next Monday, it's plain and simple. Jesus said in John 14:1, let not your heart be troubled. Let not your heart be troubled. Let not your heart be troubled. That's it.
Let not your heart be troubled. Well, the fight against heart disease requires a comprehensive approach that includes education, lifestyle modification, and access to quality health care. All right, we must continue to focus on reducing the incidence of heart disease in communities that bear the brunt through prevention, early detection, and treatment practices. Thanks again to Congressman Danny Davis and Nikki Harvey for creating this environment where we can all come together with the community. And I'm Dr. Maya Green, also known as Dr. Maya 100, keeping it 100 with 3 minutes over. Sorry, Nikki. We'll see you next Monday.
All right.
Take care.
Thank you,
God bless
everybody.
everybody. Thank you for your prayers. Thank you.
Thank you.